Good afternoon, everyone, and welcome to our PAC Prevention Town Hall. And we're very excited that we're back up and running and doing this. It's been a long time coming, and so I'm very grateful for everyone who has been in this county for so many years doing the incredible awareness and prevention work. And I know that our superintendent is not here, but I certainly am mindful of his pioneering work with PAC prevention, Superintendent Forson, and to all of the board members that started this work, to all of the officials and members in our community. So we just wanted to honor them. The way we're going to start tonight is I'm going to ask our executive director, Susan Jackson, to come up. And after she speaks, then we'll continue from there. Welcome.
Thank you guys for being here, and thank you, all you folks out there in the internet world, for tuning in to us. My name is Susan Jackson, as Art said, and I am the Executive Director of PAC Prevention Coalition of St. Johns County. A little bit about me: I worked in the field of primary, secondary, and tertiary prevention for more years than I care to share. Okay, 30. At PACT, we work to reduce and prevent alcohol and drug misuse in St. Johns County. That's our mission, that's our heart, that's our goal. Some of you may have heard this story, some of you hopefully have not. There was a couple of guys walking along the riverbank. They were just chatting, just having a normal day, and then all of a sudden there was a baby floating down the middle of the river. So they get in the river, they get the baby out, and they look, and there's another baby coming down the river. So now they're getting in the river again, they're getting the baby out, another baby, and finally the one guy said to the other guy, "What are we going to do?" And the other guy said, "We're going to go upriver." And that is primary prevention. And that is what PAC does. Today we're going to go upstream. So I have a request. Actually, there's three things that I want to ask of you guys today, and any time that you want to be this. Number one, bring an open mind and an open heart. Number two, be curious. And number three, be kind. I want to thank Pastor Juana from the First United Methodist Church, who has been very supportive of us meeting here today. And she is a lovely person, and if you don't belong to a church, you might want to consider coming here. And also, we've got some wonderful folks in the audience that I'd love to mention, and we also have a bunch of panelists coming up, and Art's going to be introducing those to us. In our audience today, we have folks from Stuart Marchman, Mental Health Services. Anna, you want to give us a wave? If we have any questions during the meeting and there's any questions about mental health services, Anna's willing to kind of help us. We have folks maybe not here but watching from a distance from the Department of Juvenile Justice. And Michelle Damon, who is on our PACT Board of Directors, is from Care Connect. And I think, Michelle, you brought a couple of folks with you. We have David Talbert in the back, who works for the St. Johns County Sheriff's Office. He's another board member. And next to him is Jan Caban, and she's also a board member, and she works for the school district. So we have a wonderful board, not forgetting Art Butler, who has set most of this wonderful opportunity for us to come together up today. So thank you, Art, for your tireless effort in setting this all up. So those of you that are board members, would you just kind of give us a wave or a stand up? Because I would really like to personally thank you for serving on the PACT board. So thank you so much. I forgot, Mary Ann Steinberg is also on our board, but she's one of our panelists too. So thank you, Mary Ann. a brief bio about him, and he forgot to give it to me. So I'm going to give my bio from the heart. I've been with PACT for 8 months, and I had heard about art before, and I'm thinking, who is this art person? And then finally one day we connected. I don't know if it was phone or email, and it was like we instantly bonded. But listening to me and Art have a conversation is insanity because we are both all over the map. And the scary part about that is we get each other. So I don't know what that means, but I have a feeling that in the future there's no telling what kind of wonderful things we're going to be able to do together. So Art is going to be our moderator for the meeting today. And I think that I'm going to turn it over to you, and he's going to announce our panelists and our lovely ladies that are going to train us about Narcan. So thank you guys for being here.
And also, too, this is an interactive town hall, and so if you have your smartphones, and we're hoping those on Facebook and YouTube will join us, you can go to menti.com, menti.com, and when you get to menti.com, there's a code that you can enter, and that code is 7250-8173. 7250-8173. And what we're hoping to do is to just provide some data. One of the things we learned at the Florida Summit in 2020, February, is the power of data when we all use it. And my takeaway from that summit was not only with our Surgeon General, but so many providers and key people in this work, key stakeholders, giving us not only insight, but direction from facts. And that's what this will be about tonight. Our county has provided some incredible facts, and it's pretty cool. This is just letting you know the people that have signed on. So I love that. Some incredible facts that we can ponder, we can consider, and our wonderful panelists are going to go into how this data fits into their work. First of all, to their own personal stories, their work, and their vision for this entire county. That's our goal tonight. And so we come up with the term framing our fabric. How does every single one of us, over 200,000 of us, fit together, frame together, continue to be woven together through our pain, through our struggles, through our triumphs, for not only the generations that are coming up after us, but those who are not even yet born. So that's the goal here. And so we're going to help our guests here from, I important too, because it also speaks to um, fabric. You know, we know that where there is longevity, there is investment. And so who are the people that are invested in this community, in this county, and in this work? And so as we look at those citizens, we look at the work we're doing, and we must include them. We include those who we provide to, and in those who are here. So we wanted to have that as the second question. And the third one, what age group represents the largest demographic in St. Johns County? Very interesting. 65 to 74. 65 to 74. And that's a key part of our conversations. We know we're working with youth, and so how does the youth now connect to our seniors, who represent the largest demographic in our county? And let's ponder this as we go forward, all right? Are there any questions? And yes, this is not working properly, but we're going to keep moving on, so I apologize. But, you know, it is what it is, and I'm just glad to have you guys here, and let's get started.
Hi everyone, my name is Nikki. I am with Inspire to Rise in Duval County.
Hi, and I'm Melissa Salazar, and I'm with Inspire to Rise, a certified peer support specialist out of Duval County.
Did you want us to use questions for this? Not sure where they are. Yeah, I'm not sure where the question or the PowerPoint or I'll set up the. Oh, okay.
There we go.
Yeah, it's going to move around a lot. Okay. Um, I didn't realize we were going to start from the slide. I'll start over. Yes, my name is Nikki. I'm with Inspire to Rise in Duval County. So I am a peer recovery specialist. Um, my degree, I got it while I was in active addiction from the University of Florida. So ironically, my degree is in criminology. So I specialize in mental health and addictions. And I'm also a certified Narcan trainer. I've been doing this work since 2018, so a year after I started my journey in recovery.
Hi, I'm Melissa Salazar, and so I'm a person with lived experience. I have not used any substances in over 10 years, and so I have used my lived experience to become certified as a peer support advocate in the community to be able to assist others and be a role model of recovery. And
So another organization that we're also with is the Florida Harm Reduction Collective, and that might be the thing that we're listed under. So we partner with a lot of agencies, but Inspire to Rise is the main one, and then Florida Harm Reduction Collective. So that's a collective of statewide organizations that are harm reduction focused, holistic focused, and we come together to leverage our resources, our funding, to come together and kind of do the work together in Florida. So we are going to do some prevention and training today, if this slide will work. Yeah, I'm not sure. Oh, okay, there we go. So what is harm reduction? Is anybody familiar with harm reduction in here? Awesome. So harm reduction is pretty broad. That can apply to a lot of different things. That could be a seatbelt, that could be a helmet, that could be the electrical socket covers that you put on your sockets for kids so they're not sticking forks in them. But it's basically a practical set of strategies and ideas aimed at reducing negative consequences associated with drug use when we're talking about mental health and addiction. It's also a movement in social justice built on a belief and respect for people who use drugs. And this is a quote from somebody who's in our network. We've created this narrative in substance use where we do not allow people truth out there. What is the knowledge, and just being truthful about the state of where we're at today instead of trying to cover it up.
And so what is an opiate? Obviously, all of us know what opiates are. Opiates work to depress the respiratory system by blocking receptors in the brain. So when we think about opiates, we are considering heroin, morphine, Vicodin, Percocets, methadone, OxyContin, oxycodone, and fentanyl, also carfentanil.
So, is anybody familiar, well, probably everyone's familiar with Narcan and naloxone. Has anybody really had to use it? Do they know where to get it? Okay. So Narcan it can be used on anyone regardless of their age, weight, or gender. If you use it on someone and they are not overdosed, it will not harm them. The only thing that's going to happen with somebody who is overdosed is that they will be thrown into an overdose state. So they may wake up very angry, they may be cussing, they may try to hurt you, but they will be alive. You cannot get high off of it. It does not have the potential for abuse.
Okay, what are the signs and risks of fentanyl and carfentanil? Anybody? Okay, so tingling in the extremities. Shorter acting drug that requires more frequent use. And so according to the American College of Toxicology and American College of Clinical Toxicology, you cannot overdose from casual contact from fentanyl or carfentanil. So if you have contact with your hands, you're not able to overdose from that.
Fentanyl needs, and the analogs need a solvent in order for it to react. So if you're just touching it, you're not going to overdose, you're not going to have a response from it. You may have like a panic response, but obviously that's not going to send you into an overdose state. So it needs to have a solvent in order for that to happen. And so Dr. Ryan Marino, if you would like to look that up, fentanyl for first responders, he has like this document he created where it's busting the myths of fentanyl. So it's a really awesome document if you're interested in looking that up. And recognizing the signs of an overdose. This is something that people ask about consistently, and overdose for different drugs looks different. So with an opiate overdose, it's going to be a reaction of a slowed respiratory system. So loss of consciousness, unresponsive to outside stimuli, shallow breathing, or what they call a death rattle, so they might be gurgling, blue or ashen complex, so if the person is white, you might see that their fingertips or their lips are blue, and if they are black, darker complexion, you might see that they are ashen colored on their lips and their fingertips. Vomiting, slow, erratic, or no pulse. And if you're able to look at their eyes, they're going to have pinpoint pupils.
So what forms does Narcan or naloxone come in, and what are the considerations? So we have several different forms of Narcan. We have the 4 milligram and the 8 milligram intranasal. We have the intramuscular, and recently approved for generic nasal naloxone. It may put somebody into a withdrawal state. There's not enough on hand, especially if it's mixed with fentanyl and carfentanil. Administering Narcan to someone who is not overdosing can lead them to mistrust or avoid services in the future.
So one thing that we've noticed is while we do street outreach and give out Narcan to people on the street who don't normally have access to Narcan, we've been asking them about their responses to Narcan, and sometimes they've reported to us that they've used up to 6 doses of Narcan, so 6 sprays in the past few years, it's been that, you know, 2 might do it or even 3, and that was a lot. And so we can see that obviously the drugs on the street are getting much stronger, and that's a huge concern. So I always recommend, hey, if they're not breathing, you keep doing as many Narcan sprays as you need to until they're back, and obviously call 911, which we'll get to in the training. So it's a big concern when you see that spike in the use. So on to the training part. These are the steps, and we'll break them down and go through them. But there's 6 simple steps. So check for responsiveness, call 911, give rescue breaths, administer the naloxone. But naloxone, if you didn't really know the difference, naloxone is the medication, Narcan is the brand. So this is actually the brand. And then it also comes in, like she was saying, the atomizer. It's like almost like a push type thing, a different kind of pusher. And then Evzio, which I think that they've discontinued. It's an auto ejector that kind of prompts you through the entire process. So after you've administered, continue breathing and then assess and respond based on the outcome.
So when we're checking for responsiveness, you want to try to stimulate them. Shout their name, shake their shoulder, give a firm sternum rub by making a fist and raking your knuckles down. So like this, and up against the person's breastbone firmly and repeatedly. You want to check for breathing, and then you're going to process to step 2, which would be call 911. So if they're still unresponsive, we're going to go ahead and call 911 and get them on the phone. If there's more than one person around, to instruct the other individual to call. Place the call on speakerphone and place the phone on the ground if you need, and if you're attending to the individual. Report that the person is breathing. If the person's breathing has slowed or stopped, he or she is unresponsive, and make sure to give an exact location.
So this is what the recovery position looks like. And if you have to leave the person to get to the first responder, to go get the Narcan, remember to put them in the recovery position so that there is a clear airway and there isn't a risk for them to potentially choke on something in case they end up vomiting. So you want to place them flat on their back and then roll them over onto their side using their knee to kind of support the rest of their body that they're folded over onto. And then place that person's top hand, the same side as that knee that you rolled over on the side of their face to kind of support their neck and their head. And make sure they're accessible and visible. I mean, sometimes you can't really help that. Don't close or lock the doors. That would keep them from being accessible to a first responder.
So we're going to want to give 2 rescue breaths. When you place the person on their back, tilt their chin up to open the airway. So plug their nose with one hand, give 2 even regular sized breaths. So blow enough air into their lungs to make their chest rise. And if you don't see their chest rise out of the corner of your eye, tilt the head back more and make sure you're plugging their nose. Then you want to administer the Narcan. The nasal spray does not require preparatory spray before use. So you'll place the nozzle into the individual's nostril with your index finger and place the middle finger on the outside and your thumb into the center of the plunger. So you'll plunge the center piece all the way down to release the medication and watch the clock. If the individual has not responded in 2 to 3 minutes, you want to administer a second dose in the other nostril.
Rescue breathing or CPR. So place the person on their back. Okay, we just went over that. I put it in there twice. It's really important. So repeat, give 1 breath every 5 seconds. I know that I've heard this before, and I just learned this yesterday. Actually, you may have heard that recent CPR guidelines recommend hands-only CPR, especially now that we've had to deal with COVID. they recommend these guidelines for layperson response to cardiac. So it's still recommended that you perform the rescue breathing for a person who has overdosed because the primary issue is respiratory depression. So I know that COVID is a concern for people, and they do have the mouth pieces, the mouth guards. So that's something that we've been working on getting into things that we distribute during outreach. So just a little thing to keep in mind if you are also doing that kind of work, to kind of get that extra emphasis out there for people to be able to do the rescue breathing if there are concerns. So very important, because within 3 to 5 minutes, I believe it is, the person can start to experience brain damage if they're not breathing. So yes, continue the rescue breathing until the Narcan takes effect, or until emergency medical services alone.
So you want to assess and respond. If the individual is still unresponsive, continue to administer Narcan every 2 to 3 minutes, switching nostrils each time. You want to wait for paramedics to respond. An individual can still go back into an overdose state after being revived via Narcan. Narcan can wear off in 30 to 90 minutes, so it is important that the individual receive medical attention or stay with someone for the duration of the time frame.
Okay, so overdose prevention strategies. So engaging active users. So needle exchange. I don't like that word. We like to use syringe service program, because that will kind of tell you it's more than just exchanging needles. We're actually engaging them in a variety of resources. So we're also engaging them if they need in detox services, community programs, education programs, if they need to be, screened for other psychological issues, Medicaid, Medicare.
HIV and Hep C testing,
Absolutely.
STI referrals
Yes.
to different clinics, well women exams.
Yes. So it's holistic. It's not just about exchanging needles. That's not the primary thing. So we're also focused on the entire person. So needle exchange is not just it. It's a syringe service program. So we're offering a lot of other things. Harm reduction therapy, peer training, which is what we do, and advocacy for people who are in these states of their life. And of course outreach, which we also do. We love outreach. We love going out to the community and talking to people and finding out what they're experiencing and how we're going to fix it. Because it's not just top down. It comes straight from boots on the ground work and finding out what these people are experiencing. Test shots and not using alone. So that's really important. That's a safety plan that we implement with people when they tell us that they're using and they won't plan on stopping anytime soon. We have to put things in place in order to keep them alive so that they can eventually reach the point where, they can have a stable and healthier life. Drug testing and fentanyl test strips. Fentanyl test strips are actually covered in some of our federal grants now. So that's really exciting for us. But we show them what that's about and how to be safe with their usage. Overdose reversal training and naloxone, Narcan availability. I actually trained somebody on the street before we got here. He was an active user and he didn't know how to use it, which was very surprising to me. Law enforcement assisted diversion, it's LEAD. So this is a police program that's more, I guess they work more with people who are in active addiction instead of the program being more punitive. As we know, we can't arrest our way out of these issues. And safer use facilities. If anybody has heard of it, it's called Insight in Canada, Vancouver, Canada. It's like a safe injection site, basically. So it's like a syringe access program, almost, but like a step up. So they offer comprehensive services too. And so some of the features of those kind of facilities is that they have bathroom doors that open out instead of in, and like those little features like that make a huge difference when you're dealing with these populations because you're able to get to somebody. And those little things like a door opening in, the person could be there behind the door. So it's a barrier for getting to that person. It can take minutes. So, I mean, those little things like that can really save a person's life. And it's just those little thoughtful things, that we think about and we implement.
The one thing you left out was medication-assisted treatment.
Oh, I'm sorry. That's your specialty.
So with medication-assisted treatment, we have medications that will assist individuals, with finding their path to recovery. We have Suboxone, Vivitrol, Sublocade, which is an injectable form of Suboxone, and methadone. So we try to implement all of these services so that way people can reach out when they're ready and start getting the treatment and the care that they need. And this is our information right here. You can also see us at the table if you want to ask us any more questions about the programs that we run and the services that we provide throughout Duval County. Please let us know.
Yeah, and if you have any other questions, feel free to reach out. And we have these on the table. It's our webinar for technical assistance for harm reduction and syringe service programs in Florida. Because we do have the law passed that we can open syringe service programs, but it needs to be passed locally in Burke County. So we have that. If you guys want to sign up for that or ask questions, please do.
Thank you. So, Melissa, I have a question. This program, what are some of the things you guys hope we will see with this program that we have in the past?
We just got done with a series a few months ago, and we did a lot of different topics. One of my favorites was law enforcement needs, active drug users and bringing down the stigma and kind of meeting each other halfway.
Yes.
Because I know from my personal experience, the fear is there. It's very real, and we want to find out how to work together to solve the problem instead of fearing each other and having each other butt heads every time.
Yes.
Where to disconnect, where to solve that. We also focused on stigma in the healthcare system. A lot of our participants don't want to go into urgent care or any healthcare facility because of the stigma they face, and they'd never go until it's very dire. They don't get preventative care because of the stigma they face. What else did we focus on? Strategies, best practices of outreach and intervention. A lot of different things. Yeah, it was good time. I enjoyed it.
Nikki. And we're going to hear from some of the other panelists that are going to also go into more detail. I sincerely apologize to those of you who are listening on Facebook and on YouTube. We do understand that although we can hear in the room, when we leave the microphone, we leave you guys out. So we'll be cognizant of that going forward, to use a microphone so you all can hear. So thank you all. The next phase of what we're going to do, and I'm going to introduce the panelists and have them come up and just talk a little bit about who they are and what they're doing. So we'll start with Christian Whitehurst. Thank you for coming. Yes. So Commissioner Christian Whitehurst, a third-generation Floridian, has been a part of the Drillington Creek community for over 20 years. There's that longevity we talked about earlier, and continues to reside there with his wife and 2 children. As your job creator and business owner in Northeast Florida, Christian understands the importance of strong leadership in St. Johns County. Christian was appointed to the United Way of St. Johns County Campaign Cabinet in 2015. He continues to volunteer both time and resources to organizations including Daniel's Kids, March of Dimes, and Special Olympics of Florida. Thank you for being here. We also want to invite up Carrie Bachtia, who is the Medical Director, Board Certified Emergency Physicians and Medical Director for St. Johns County Fire and Rescue. Yes, so glad to have you here, and I just appreciate the conversations that Carrie and I have been having the last couple of days, and so we're excited to have you here. Major Nathaniel Dinger, come on up, it's good to have you. Good to see you. Yes. Major Dinger currently serves the state of Florida as a member of the Florida National Guard. And not just the Florida National Guard, but the Counter-Drug Program and the Drug Demand Reduction Outreach Prevention Program, and he is a coordinator there. Major Dinger entered the United States Army in 2002 and attended basic training at Fort Jackson in South Carolina, where he was trained as an Army finance specialist. He has numerous awards of decorated service and has been here in our county. We have come to love him, to appreciate him, and often selfishly pray that he remains here for a long, long time. So we're so grateful to have you here, Major Dinger. We're going to invite up Maggie, and I'm going to attempt to pronounce this correctly, Chef Chestnacini, and she brings over 16 years of experience advocating for children and families impacted by substance abuse, trauma, and domestic violence. Many of those years were spent providing training and technical assistance on a state and national level. She's also created sustainable integration programs, participated in projects to reduce stigma-related substance abuse, mental health, and is working with the grant management aspect of that. Maggie has been an integral part for our community and the base care agencies here, mental health, substance abuse, provision in the Northeast region. And she's been doing this for 6 years. And she's also in the Department of Children and Family Services as the Director of Substance Abuse and Mental Health for our Northeast region. So we just thank you, Maggie, and for your team of providers who serve in this community and serve our families in so many areas, and we appreciate you being here today. Next, we want to invite up Eugene, and I appreciate you, Eugene Talbert, for being here today. He's in his 20th year at the sheriff's office, and he spent 10 of those years in major crimes, 8 as a detective and 2 as a sergeant. I know a lot of people that know Sergeant Talbert, and although he and I have never met before, I am extremely grateful for what you do behind the scenes and what all of you do behind the scenes. And it does not go unnoticed. And thank God for you, and thank you for being here today. Thank you. Yes. And Mary, and my sister, is so grateful to have you here. Fellow board member here at PACT. She inspires me in so many ways, and we're just glad that she gets to really lead the talk today regarding tobacco and more specifically vaping. And so I'm also grateful that we will be working directly with each other starting July 1st. So I'm excited to see how you will continue to teach me and train me in this work that we're doing. So thank you all for being here. All right. So we're going to start with Carrie, and you talk, and then we'll do some slides after you're done, okay?
My name is Carrie Bachista. I'm, like I said, the medical director for St. Johns County Fire Rescue. I've been here since 2016. I think what we wanted to talk about in regards to the opioid crisis is sort of what we've noticed and sort of our response over the past couple of years. I think we noticed an uptick in opioid-related calls sometime 2017, 2018, that it caused us to respond by, as you heard from the previous presentation, giving more Narcan because of some of the synthetics that were on the street. We noticed that the amount of Narcan we were giving was going up for each patient in order to get a response. And from that, we had to make some changes to what we did. We increased the amount of Narcan that we were giving to each patient just to try and get a response. We switched to some of the rapid deployment nasal atomizers, and we worked with our partners at the Sheriff's Office to give Narcan to the Sheriff's officers and the Beach PD to allow them to get there quickly and hopefully reverse some of these opioid overdoses. We've had some good results with that. We've had a lot of near misses where we've gotten there just in the nick of time, given the Narcan right at that last second and been able to bring some people back. And as a result, we've been tracking the Narcan use and the Narcan related calls that we get, and they've been pretty steady over the past couple of years. We roughly get one call a day, give or take, where we're deploying Narcan to the patient. 2/3 to 3/4 of those will get an improvement, meaning it was definitely some kind of overdose. The other cases, it was mainly a suspected overdose. But we've noticed that those numbers have been pretty steady. We've also noticed that as some of the statistics and data you've seen, we've noticed that the number of overdose deaths seem to be creeping up as well. So I guess one of the questions that we discussed earlier was, is there an issue with opioids in the county? And I think there is. I think there is. Of course, any opioid-related death, I think, is sort of needless. So hopefully, any more than one, it's needless. But we do notice that we've been steady and it's still going.
The Narcan tools, device, how many of you have personally had to use that? Just by a show of hands here, have at some point had to use Narcan? How many of you are aware how to use it before today, or aware how to use it? Yeah. And I would just encourage you, the takeaway is to have conversations and to pursue the ability to get this into your homes, into other homes, into as many communities as we can. To our faith-based leaders who are so grateful that Pastor David Williamson from Grace United Methodist Church is here. Let's get this to our faith-based leaders. It's vital that we do this and continue to educate ourselves. So thank you, Carrie. Maggie, you go next.
Hi, I'm Maggie Svetichnin, and I work for the Department of Children and Families. And I think, obviously, we see a lot of this in the work that we do. Our investigators try to work with families as quickly as possible when there is drug use suspected, because our goal is to try to keep those children in the home. And so I do ask, we just started a pilot, actually with Inspire to Rise, a substance-exposed newborn pilot in Duval, and we'll be expanding that hopefully. And the goal is to reach these moms and dads before they come to the hotline of DCF, because we actually cannot accept a report, and I don't think a lot of people know that, on someone who's pregnant. That baby actually has to be born. So our goal is to really reach to these moms and dads beforehand so that we can wrap them around with services and stabilize the family and make sure that those children can stay in home. I think we've seen an increase in opiates because we've also seen an increase in untreated mental health. And I always have to say this, a lot of people who use drugs, especially opiates, have mental health issues. And we have to address that as well. If we just send somebody to treatment for substance abuse, what happens? They come out. If we have not addressed their mental health, they go right back to using. Same thing if we treat their mental health and we don't treat their substance use, they come out of treatment and they're still using. So it has to be that we address both. Inspire to Rise is one of our providers, SMA and EPIC. And so I just encourage everyone, when you're working with families or when you come across a family that is using substances, especially opiates, that you are talking about mental health. It's a huge stigma, especially still today, which is 2021. I can't believe it's still a huge stigma of mental health, but it is, and drug use is still a big stigma. I actually think drug use is a little bit less stigmatized because we talk about that more, but I still see that mental health is still very prevalent among this population, and we have to treat both together. I have a mental health disorder. I say that. It's not comfortable for me to say that, especially live on Facebook and YouTube, but I say it so that other people will step up and admit to it, because that's the only way that we're going to reduce the stigma and be able to move forward. Because as you said, one life dying by opiates is too many, and a lot of times it really is suicide, because if you've ever taken heroin, you really are putting your life on the line in that very moment. And so that, to me, is a form of suicide. Someone's reaching out for help, and we need to be there to be able to catch them and give them the services that they need. Thank you.
And to continue what Maggie is saying, if you guys want to, hopefully this will work, what population do we see as most vulnerable in St. Johns County? Is it ages 0 to 18, 13 to 19, or civilians non-institutionalized with a disability? Kind of gave it away. But it's vital that we consider, again, we can all go away with continuing to dig into this information, dig into what's being said here, and just kind of keep that thought there throughout the rest of the day, okay? So, thank you. All right, Major Dinger?
Good afternoon. I'd first like to kind of thank everybody for giving me the opportunity to be here. It's very rare that I have the opportunity to get out of the office and actually talk about this stuff, so I just kind of wanted to dive in. I'm not as smart as everybody else, so I took notes. And there's a couple things I wanted to make sure I hit. First and foremost, we often talk about the Florida National Guard Counter-Drug Program as essentially the best kept secret in the state of Florida. Most people don't know what we do, and in my job, really very, very few people across the state know what we do. In the Drug Demand Reduction Outreach Program, we literally work with coalitions, anti-drug task forces, schools, community centers, treatment centers, anyone who will basically partner with us. We basically try to provide free services to reduce drug use amongst teens, youth of all ages, adults, any organizations that are out there, as well as, again, treatment providers, anyone else. How we do that, we have a program, Night Vision program, which is a drug prevention class that's about an hour long. It meets the Sunshine State standards for prevention education. We partner with the school. We've actually took a lot of guidance from the school in order to develop it, and our representatives go out throughout the state and actually use that curriculum to provide that course, and then it actually meets the gates for the teachers and educators throughout the state. We also help local communities that maybe have never done it, or we helped other communities that have done it expand their DEA and community take-back capabilities so that they can remove drugs from the home, so that a lot of youth don't necessarily have the opportunity to experiment with something that might be sitting in their house, especially during COVID, where you have a lot of isolation with students and you have a lot of depression with youth, and just kids that have a lot of free time and potentially might be tempted to try something like that in order to self-treat with some of those issues with depression, anxiety, and isolation. So what is important for prevention on my point of view? Obviously, youth prevention is extremely important. The more we prevent in the early years, the less law enforcement has to ever engage with them, and the less the wraparound services like, any of the other the treatment providers ever have to engage with them. And the more fulfilling those children's lives can have when they grow up, as well as their children's lives, and so forth and so forth. Just by teaching these kids and giving them the ammunition to live a healthier life, these kids can go forward and actually understand the risks associated with drug use, and hopefully avoid them altogether. And then when they move forward in their lives, they can literally have a happier, healthier life, as well as fix that family. Because as we all know, when someone becomes addicted to a substance, it's not just that individual who suffers; it is the entire family. Community involvement. That is the biggest thing that we like to take on. As we all know, it is extremely difficult to get a community engaged. So we go out, we recruit everybody that we can. We individual community members, organizations, different legal agencies, law enforcement, community churches, faith-based organizations, any agency that is willing to play, we invite them in. Most of them are more than willing to participate, but a lot of times they just don't know what they can do, so they kind of sit the bench until somebody invites them on board. So we take pride in going out and try to engage in these different organizations and bring them on board. To jump into the mental health, that's a big thing. To really understand what mental health is, in my opinion, you have to experience what positive mental health is, and you have to experience what negative mental health is. I too have a mental health disorder, and unfortunately, I didn't really realize what the difference between positive mental health was, and negative health was, until I experienced a negative mental health disorder. So for me, it's extremely important to go out and talk to people about it, educate my soldiers about it, because as we all know, military, law enforcement, fire department, all of those different high-stress jobs, the reality is that we're out there every day, we're doing things, we're making decisions, we see things that we can't take back, and when you've been in as long as I have, you're going to have scars, you're going to experience trauma. That's just how it is, and if you are going to be in that line of work, the reality is that you're going to need experience to treat, you're going to need help to treat with that. And if that's by way of a counselor, that is absolutely what you need to do, and I tell my soldiers that all the time. I often tell my soldiers that treating mental health disorders should be treated like a broken leg. The reality is if we could actually get to the point where a mental disorder was actually looked at as though it was a compound fracture or a broken leg or a broken arm, no one would question going to the hospital or reaching out for help. But the reality is that so many people are ashamed of whatever has happened to them, whatever is bothering them on a mental level or on a psychiatric level. They do not go out and they do not seek that help, and many of them, unfortunately, start to use substances on their own. Once they start using those substances, whether it be alcohol, whether it be some type of other drug, they immediately go into this self-treatment phase, and then they develop into a comorbid disorder, and then that only magnifies their problems to the next level. So the reality is if we could find a way to change that stigma out in the public to where it's a mental injury versus a mental illness, you could finally get to a point where the public would actually break down that wall and actually reach out to people a whole lot easier, and then people would actually go to the proper legitimate care, professionals that they need, and pursue that care. A substance use disorder is in fact a disease. There is no way to look at it in any other way. A substance use disorder is a disease. Self-treatment of another mental health disorder often leads to a substance use disorder. We already talked about that. If you have two, it's only going to make it worse. It's only going to make it worse. When in reality, the shame associated with stigma wasn't present, and the individual could have open and and the individual could have openly seen a professional prior to the self-treatment of drug and alcohol, the situation could have resulted in a far less complex treatment plan. That is the reality. But unfortunately, so many people go a different route, and that is what we are dealing with in the public today. All right, that's all I actually have. Thank you very much.
While you guys, if you all can keep your phones, we are going to do a poll. We're going to do a poll, those of you on Facebook and YouTube. So if you can go to your phones, again, go to menti.com, menti.com, and use this code, 1116-920. 1116-920. And that's menti.com. And while you all are going there, I just want to ask a question from our panelists. And there's a theme that is happening here, very organic theme. And we're hearing our team, our people, our trauma, our mental health. And we purposely use this church and this fellowship hall because we recognize behind these 6 individuals the frame. I'm not sure if you all can see that frame on social media, but in that frame there are some words: hope, faith. And this frame represents the individuals in this organization, in this church. And so there's a frame that we are building here tonight through everyone that is here. And as we focus on that frame, what I would like to ask our panelists, how, and you can answer, one statement or quick statement, how is the guidelines and the work that you guys do affected by laws? And how can we as citizens participate in what you're doing from where we are by getting involved with the changes that can happen through bills and through laws? And if anyone wants to respond from your work, I know there's a lot of challenges in the work you guys do. So what can we as citizens, and we're not professionals, we're not providers, but what can we still do to be a part of that framework from where we are?
I think one thing is that a lot of times people just don't know who to reach out to when they have questions or concerns. And that's one of the opportunities I think being here today is that people have feedback, they have concerns, they have worries, they see things in the community, and a lot of times they don't know where to go to address this. And I think as community partnerships, this is something that we can, besides the education that we give people on substance abuse, I think we also have to include information and empower people. How do you reach out to elected officials? A lot of people don't know how to do this. Here are our website. This is how you can do it, too. So I think we can also empower people and educate people, too, on how to outreach to their elected officials. And I think that's something that we need to do, probably improve on, too, is just the networking of communication within the community.
I know that Scott Rivkees, the state surgeon general, is the president of the Drug Policy Advisory Council, and every year he produces an annual report. He and his team produce an annual report. That annual report is given to the governor, the president of the Senate, as well as the House of Representatives, and in that document are recommendations that actually speak specific to treatment. They speak specific to prevention. They speak specific to law enforcement, things of that nature. And I know for a fact that some of those recommendations talk about stigma reduction, and those documents are available to legislators during the session. If you agree to those things, if that's something, if that's again, I'm not a lobbyist. It's not even something that I can do, but that's how you do it. You reach out to your folks and let them know what your opinion is.
Thank you.
I think another thing is for citizens to learn about harm reduction. Inspire to Rise talked about it today, but it really does save lives. To absolutely walk away from drugs sometimes is not easy for someone, especially if they still have untreated mental health. I would rather have somebody on medication-assisted treatment. I know there's a stigma around methadone as well, but I'd rather have them going to a clinic and getting a dose of methadone versus getting fentanyl off the street or something laced with fentanyl and overdosing. And I think we do need to really start learning about harm reduction and be open to it, because I would rather have somebody, go from opiates to having 3 drinks a day or 4 drinks a day. That's harm reduction. We're still in substances, but we're reducing the harm. That's what we mean when we say harm reduction or medication-assisted treatment. And I think people sometimes view recovery as one path, and there's many paths to recovery. And I think we need to be open to that.
Just want to introduce myself. My name is Christian Whitehurst. I'm one of your county commissioners here in St. Johns County out of District 1. And as an elected official here in St. Johns County, the reason I agreed to be on this panel is certainly not because I'm a subject matter expert. I came here as much to learn as I did to impart anything upon anybody today, because as an elected official, as a policymaker here in St. Johns County, I need to be able to make informed decisions. So being able to sit on the panel with people who are on the front lines, who are actively working on solutions, I think Ms. Jackson said it very well during the introduction, is, I walked into this open-minded and curious. How much is the opioid epidemic a part of St. Johns County? And I see, 19 opioid overdose deaths. I know that's just not 19 lives that were affected. We lost my cousin to a opioid overdose last year, and I can tell you that's an entire community that's affected. The ripple effects that one opioid overdose death has can impact hundreds and sometimes thousands of people. So what is the reach of 19 deaths on a community? I don't know. That's probably too abstract to quantify. But what I will say is, as somebody who gets a vote on the budget here in St. Johns County, as somebody who meets a lot of people, I was very excited to come sit on this panel just to sit next to some folks who are working hands-on in the field on some of these solutions. And obviously, you can have my card. We don't have a lot of staff. When you call my number, you get me. When you send an email to me, it's just me. So that's one of the benefits of having local officials, is that we are pretty accessible, and obviously, after this is all over, I'd be happy to meet anyone who has any questions.
Thank you, Christian. Thank you, everyone. So this is interesting. So we have 150% or 180%? Again, over the past 3 years, what is the percentage of increase in overdose deaths? And it is 180%. 180%. And this is just sort of a teaser to some things that Marianne is going to continue to talk about. And let's just do one more slide here quickly. If you guys can go ahead and put your answers in. Since 2016, the number of kids vaping increased. What was it? 300%, 704%, 500%. I'll let Marianne give you guys all that really powerful information behind the stats.
Okay. With Tobacco-Free St. John's, our work encompasses a large variety of tobacco-related issues. We work with cessation with both adults and youth. We work with tobacco-free environments. And a large focus right now is on our youth prevention and advocacy. Tobacco-Free St. John's is policy-focused. Our work is policy-focused, and that doesn't mean that education is not important. Education is extremely important, but education has to be supported by strong local policy in order to be effective. Just the youth tobacco use in St. Johns County remains a major problem. According to the 2020 Florida Youth Tobacco Survey, about 1 in 3 youth have tried, ages 11 to 17 have tried a tobacco product. 1 in 6 youth are current users of tobacco products, and that's probably at this point primarily vaping products. And kind of surprising too that 70% of youth report being exposed to secondhand smoke on a regular basis, so that's concerning. We do a lot of surveillance in our work in the county, and this past year we did a lot of surveying on tobacco retail stores and did environmental scans. And we see a lot of things that the price point is very price point friendly to kids. The past few months when I went and surveyed stores, there are vapes as low as 99 cents. You can buy Juuls for $4. You can buy some of the disposable products for $2. So the price point is very right for kids. And when we do compliance checks, we've done compliance checks, the FDA. I have some stats from the FDA, but in the various zip codes, the number of non-compliant or people that sold to underage was anywhere from 12% to 21%. And so that's about a 16% average across the county. And that's actually surveying a relatively few number of stores in the county. So we do know that kids, their primary way of accessing products is still by buying at primarily convenience stores and other venues. One thing that's concerning is just if we track, when you get caught vaping, they're issued a citation and they have to pay a fine and then take a tobacco citation class, and these classes are tracked through the clerk of the court. Between 2016 to 2019, we had a 704% increase in the number of kids that received tobacco citations in St. Johns County. And this meant we had to increase the number of classes that we did with kids taking the citations. At one point, about a month ago, the classes were booked up all the way through the middle of June. So we do know it's a significant problem with our youth. And you know, with our program, because we're policy focused, you know, we're following the legislative session. And this legislative session that just ended was a little bit disappointing to us because they passed the bill, Senate Bill 1080, which put us in alignment with the federal age of sale to 21, but an unfortunate part of the bill was that it added preemption. And when you add preemption is a tactic of the tobacco industry. That's something they support, and the vaping industry in Florida strongly supported this legislation. But what it means for us at the local level is that we don't have local control. We can't have a local law that is stronger than a state level law. So it limits us in a capacity as to what we can do at the local level for laws. But that doesn't mean we can't do anything. That means a lot of times we just have to get more creative with things. We have a variety of other options we can do. And you know, at this point with the legislative passing and just the preemption added in, we're sort of at a point where we're evaluating and seeing what we can do. We can still advocate for state level change. We can ask for amendments to the bill that would possibly add the opportunity for local municipalities, counties, and cities to have a tobacco retail license. We could advocate for having a license for vape stores to sell the product. And this is something in the legislation that passed too. It's a free permit to sell vaping products, where there is a license that you have to pay for with traditional tobacco products, but currently now with this legislation it's just a permit and no price. And these fees are what allow us to do compliance checks and monitor retail stores for compliance. So a lot of this is what we're working with this, and we tried to work with our elected officials, and I know Commissioner Whitehurst, we've already met with him, and we tried to keep that communication going with our elected officials, and we tried to give that information to the community as well with our program. And that's why with opportunities like this, we want people can go to our website, and if they have questions, they can email us from our website. But we really do want the feedback from the community, and how people feel that they need to have their voices heard and what their concerns are.
our town hall is related to the alarming information that we're getting with opioid use. And we often have these conversations, what can we do? The phrase is need assessment. We're often talking about this. What I personally observed is, while there's a lot of chatter about how big this is or how big it's not, and by the way, your code is 4621, 4621-2811. 4621-2811. 4621-2811. How many opioid-related deaths occurred in 2018? And so what I've seen personally is this ramp up. And so while we see vaping increasing, while we see usage on social media increasing and all these other things increasing, what we see is this ramp up for an insatiable desire for more and more. And so while our youth, we're focusing in one area, as they get older, they collide here drastically into death. And so we're hoping that again, all of this work, it's all inclusive, it's everything. Every aspect of it is huge. So we're going to ask Sergeant Talbert to talk about this and give us some good information, some good facts that will help us. And how many opioid-related deaths occurred in 2020 during the pandemic? Let's see. Let's go. Let's answer that one. That's a huge number. That's an alarming number. And we don't have to just limit it just to you, Sergeant. And anyone else who wants to speak to this, this is why we're all here. But we'll let you kind of talk about what you want to talk about and then go into that.
Sure. Thank you, Art. Yes. And before I kind of comment on that, I do want to say thank you for the opportunity to be here from the PAC board and everybody else's input on this very important topic. One of the biggest things, and I think Fire Rescue kind of alluded to it earlier, 41 does seem like a high number. I would say that St. Johns County is doing a fairly decent job addressing the opiate epidemic, and one of the largest tools that we kind of have in our toolbox as far as fighting this is the deployment of Narcan, like it was talked about earlier, to the police officers with the city and beach police department, and then also to the sheriff's office. I would venture to say, and I don't have the numbers, but I would venture to say that the number of saves or the number of Narcan deployments that actually resulted in a life save is probably quadruple that. So that's the potential for hundreds of deaths had those programs not been in place. And I've seen the numbers in the past when we started deploying the Narcan in 2018 timeframe, the drastic drop in the number of deaths that we had. Another big impact on St. Johns County has nothing to do with St. Johns County at all. It has to do with our surrounding communities. So when you look at a community, you can't just say St. Johns County and draw a line around us, put us in a box. We have to consider what Duval County is doing. We have to consider what Clay County is doing, what Putnam County is doing, what Flagler County is doing to the south. And even the middle of the state down in the Orlando area is a very big hotbed for opiate issues, for trafficking and for consumption. I also want to just take just a minute to recognize Nikki and Melissa and just how impressed I am with you guys and the fact that you guys got up here and the work that you guys are doing and the fact you can get up here and talk about the addiction that you're recovering from. I think that is a narrative we have to champion across the in order to have success in this issue that we're dealing with. So thank you for that, and if we can give them a round of applause. You mentioned about trust between addicts and law enforcement. And having been a cop for 20 years, and I think Major said it earlier, I'm not very bright either. I do just enough to get by, but I do know pretty law enforcement and there's an absolute distrust. And that is a conflict between both sides of the equation to try to build that up. One of the things, as far as harm reduction goes, that I would ask that you guys spread as far as your message goes is Florida Statute 893.21. And that's actually a statute that the legislation saw fit to put into law. And it's referred to by a lot of people as the Good Samaritan statute, to where you could actually call 911 and you don't get in trouble for possession cases. You don't get in trouble for paraphernalia cases and things like that. You know, coming out of investigations a little over a year ago and coming back to patrol, my viewpoint changed a lot as far as what we saw. And having conditions, you know, as they are right now, we frequently, because our cars are faster than fire rescues, beat them to overdose calls. And a lot of times people have a distrust of red and blue lights showing up before a rescue. So we have to educate our community in that law as far as Good Samaritan goes and harm reduction. And we have to educate them that, unfortunately, law enforcement is going to get there faster. We do have some of the tools, although not quite the cool tools that they have, but some of the tools they have as far as our Narcan goes. And I would tell you that there's a great number of lives that are saved based on law enforcement's intervention at these overdose scenes. So it's definitely a program that we need to keep funded and keep pursuing. One of the things that we started doing as an agency when I was in major crimes and investigation, 2017, the legislation changed, and they added fentanyl and carfentanil to the murder statute, along with several other controlled substances and drugs. So as an agency, we decided that we were tired of stacking up bodies and just keeping stats, that we wanted to go after some of the big-time dealers who have multiple death cases you know, under their belt, where they're dealing these deadly toxic drugs and basically getting away with it with impunity. So we started really pursuing cases. The first case that I worked on, the law passed October 1st, 2017 to add fentanyl. October 14th, 2017, I responded to an overdose up in Ponte Vedra. And the young man's name was Zach Miller. His dad, very successful businessman. And Zach took ill to an opiate addiction because of a chronic medical condition that he had. He got hooked on pain pills that were prescribed by his doctor, which is often the narrative. Just because you have an opiate addiction doesn't mean you're a piece of dirt. It doesn't mean you're subhuman. It means you have a story to tell, and there is a reason why you were there. And a lot of times it goes back to doctors overprescribing or maybe mismanaging some medication or something like that. In Zach's situation, he had Crohn's disease and dealt with chronic pain his entire life. It was very debilitating. And he actually got to the point where he was no longer on his parents' insurance. He was not employed himself because of his health condition, so he started seeking opiate pain pills on the street. And right around 2009, 2010, we had a huge Oxycontin and oxycodone problem, and that's kind of right when I came into homicide. So we were dealing with this problem then, but they were being pushed by pharmacies as opposed to drug dealers, so different version of a drug dealer. And so Zach got hooked on opiates that way, and it was a very innocent situation that occurred. And eventually Zach kind of devolved into heroin use and ultimately died from a fentanyl overdose. And the belief is that he had no idea he was consuming fentanyl. Zach had been in a 10-month inpatient, in-house treatment program, had been home for less than 2 weeks when he overdosed and died. And quite frequently, if you look at the stats, that's generally the case. And in the harm reduction field, you probably can attest to that. Oftentimes, people overdose and have fatal overdoses is because they lose their tolerance to the substance that they're used to injecting. And it's because they've either been in jail for a period of time and they've lost that tolerance, or it's because they've been in rehab or treatment. So I think one of the biggest things that everybody can kind of contribute to, and we can find a way to do better, is that aftercare as far as peer support, just making sure that these folks have a sustainable path to stay on. And it really kind of comes down to family support and peer support when it comes to that, because a lot of these folks lack the fortitude themselves to keep themselves on that path. So they really need somebody to kind of kind of be their counselor, so to speak. And I think that really comes down to education. But back to the point as far as the distrust between addicts and law enforcement, I think that there is a great deal of law enforcement who wants to understand these issues. And I think there's a great deal of law enforcement who have personally seen in their own lives family members or people close to them who have been, impacted by these problems. So I think there's a lot more understanding than some people give credit for. You're correct. We cannot arrest our way out of this. Addicts are addicts. We need to make sure that we pave a path for them. I can tell you Sheriff Hardwick is very supportive of treatment programs and things like that, and alternative diversion programs for criminal acts and things. So I think we're doing a decent job. Do we have an issue in St. Johns County? I think we have an issue in the United States. I don't think it has anything to do with St. Johns County. And we're not going to be able to insulate ourselves from our surrounding communities. So as long as Jacksonville is dealing with it on the way they are, Volusia, Daytona, Orlando, all those other large communities are dealing on it, we're going to continue to have the issue here.
And again, anyone who wants to add on to this, can you also add and share with our audience and share with our citizens the connection to our pregnant moms using? And, those children that are born in neonatal care who are going to be in our school system, and how we all can participate.
Well, as far as the participation part, I think that's a little out of my purview and knowledge. I certainly wouldn't want to dabble in somebody else's arena, but we certainly in law enforcement see the impacts that it has in our partnerships with DCF and the schools. And obviously there's a ripple effect in anything. It gets magnified by the fact that a child is involved, and it's just, tragic. It becomes, as opposed to a learned disability, and what I mean by that is putting yourself into a position where you become an addict. This child had no choice. They were born an addict, so it's an inherited disability as opposed to a choice. So I don't think that, to this point, 10 years from now, when we're dealing with, younger children that we have over the last few years, and they're coming into their teens and their adolescence, and we're starting to see that impact, I think we'll have a better understanding and a better grasp on that. But it's sad. It's tragic, and I don't know what the answer is. If somebody else has some input on it, by all means.
And I do want to clarify, when we say participate, it means education. Like, we have to continue to go to the forums and the places where the work is there, and we get to grow and learn. We got to do it. So I appreciate you, Sergeant Talbert. Anyone else have a response to that?
I am not an expert either in that regard, but I do know that Tampa General had a program for neonatal abstinence syndrome where they worked specifically with children that were born addicted, and it's available online, and you can definitely take a look at it. And their program involved volunteers coming in and basically cuddling the children that were born addicted to different substances, mostly heroin and opioids in nature. And they actually reduced their time in the hospital from over 30 days to about 2 weeks. Just by using this intensive program. And it was a great program. It existed for a while down there, but I know that a lot of the staff shifted out, and I'm not sure if it still operates down there, but I know they have all of their research down there that you could still definitely request or find on the internet. And it was very successful, and the reason they were, obviously Tampa General was very interested in it is because each child that stayed in, the NICU for over 30 days, that's an extremely large cost to the hospital. if you can cut that in half or, down to like a third of the time, that is a huge benefit to the hospital's overall financial cost and the child, so it's a win-win. But Tampa General did that, and it was a really neat program. But again, not an expert, but I just happened to be in a briefing where I heard somebody talk about it.
And I can definitely ditto what Major Dinger is saying. And Dr. Washington, by the way, headed that program. And you can certainly grab some incredible information. I had the honor of sitting in one of his teachings regarding that work, and it is extraordinary. And they took a period of time to allow these moms to tell them a story while they were using meth. And to not misquote him, but one of the things I took away was they trained the medical people to not just take away that meth, but to strategically allow for the administering of what is needed for the mom's life and for the child's life. And so that is a great work to look at. And if anyone is interested in his information, I can share that with you guys. I took a lot of notes that day. It's pretty powerful. All right, so let's do another one here. The code is 5312-0977, 5312-0977. What percentage of growth has St. Johns County experienced, should have been a B, since 2010? I chose this question for Commissioner Whitehurst because as a commissioner, we know our commissioners, just from our experience, it's the entire county. And I love what Sergeant Talbot talked about, the surrounding counties. And so as our commissioner talks to us, I'm hoping he can share just his heart and his passion for this community, not just around drugs, but around all the other things that are passionate to him and to the other commissioners here in our county.
Trying to incorporate that. Something I came here with today is sort of information from our county attorney's office. I think very wisely the county office of attorney got involved with the civil class action lawsuit against some of the pharmaceutical companies. I think objectively they've irresponsibly distributed some of these products into certain communities, and I think that's affected everybody. So we've joined a class action that's nationwide, and as a result, we're anticipating a settlement. So we don't know how much, and we certainly don't know when we're going to get those funds. But something that's going to come on to the county commissioner's agenda on the consent agenda on July 20th is the allocation of those funds, and it will be strictly earmarked for mental health issues and preventative, prevention for drug addiction and those who are addicted to help them recover. So that is something that we will have coming hopefully before the end of the calendar year, pending the payout from these pharmaceutical companies, which, we'll see what happens there. But there is action being taken by the county, by many other municipalities around the country to sort of hold these folks accountable for what have been predatory practices. I think that's safe to say. So that's one thing. In terms of, my passion for the community, as it relates to this issue, this is an issue that crosses socioeconomic lines. It affects everybody regardless of background, regardless of demographics. I have a close personal family friend, and I'm glad Sergeant Tolbert mentioned the case up there in Ponte Vedra. I think there can be a misconception if you're not educated about which community this affects. It affects every community. I had a close personal family friend OD on fentanyl. His buddy called the EMTs. The EMT came to pick him up. They injected the Narcan. They took him to the hospital for treatment. His roommate then picked up the same batch of fentanyl used and passed away as a result. So on the death certificate, you're going to see an overdose due to use of fentanyl. But I've got to believe that Major hit the nail right on the head when he said he really died of lack of treatment of his mental illness, didn't he? I mean, it's really so much. It starts with issues that become too much, and you know, of course, again, not speaking as a subject matter expert, but as somebody who's seen so many affected by this, it's a lack of being able to cope with reality, and you're seeking that sort of escape. Boy, that's all of us at some point, isn't it? I mean, it may not be these illicit drugs, but everybody goes to something. We all have a vice, and some of us are just blessed enough that it's not fentanyl, it's not heroin. We all have something. So there's certainly no judgment. There should be no stigma, and I'm glad that you guys are doing so much to combat the stigma, because it could be anybody, and oftentimes it is everybody at one point or another. So I am very passionate about St. Johns County. I do think it's the best place to live, but there's always room for improvement, and that's why I'm here, is to seek those ways to find room for improvement.
We're not going to do the traditional questions here, but we will encourage you, if you do have questions, what we want to do is to continue these relationships, continue this work cohesively. So my email, butlerpact@gmail.com. And for anyone who's listening on social media, I apologize, you can certainly reach out. Butler, B-U-T-L-E-R, pact@gmail.com for your questions, and we will make an effort to we won't make an effort, we'll address your questions, so just reach out to us. In addition, I just wanted to, I'm not sure if it's here. It might not be here. Yeah, it's not. Yeah. And I love how our panelists are not only passionate in this work, but because they're in this work, they get to see the results. And the results isn't all grave. So we see these stats and we give these stats, but we also can be challenged to do a better job to give the triumphs, to share the triumphs. It doesn't have to always be, so 30 years in media, 30 years in broadcasting, I have that conditioning of shock and awe. And so I will do a better job at bringing some of the wins when we do some of these town halls. And we did try to get some of our youth to come, and we have to work with them and be patient, because some of them are still battling, and so, but we do want to celebrate with this kind of information. We still want to celebrate our wins. And thank all of you for being here today. Thank you for the work you do. Thank you for our panelists. And did you want to? Yes. Thank you.
I want to thank you also for being here today, and I really have a question for the panelists and all of you as well. I've learned some things today, and combined with the knowledge that 10% of all of our population struggles with that addiction gene, that's 10% of everybody, so 1 out of 10 people. So what that means is, even in this small room with this small group, there are some of us that struggle with addiction, and we know that in varying degrees. And not only is it the 10% that are struggling with the addiction, but it's the people that love them that struggle with the addiction as well. So if you're 1 in 10 people and you are one person, chances are, unless you've estranged yourself from everybody because of your struggles with your addiction, there's probably 10 people in your life that are being impacted. And so I'm just doing some kind of weird math in my head, but that means that probably every single person in this room struggles from someone's addiction. And here, I mentioned this before, I'm new to this, but one of the things that has hugely impressed me today is about the conversations about harm reduction. Wow, that is so important. And I want to ask you guys as panelists, what can we do as PAC Prevention Coalition to support harm reduction and loving on folks that are struggling either directly with addiction or indirectly with addiction, I think maybe it impacts all of us in some kind of way or another. I think we all know somebody that struggles or has struggled, and I think we could all share a tragedy like Commissioner White. I mean, I'm blown away by that, and it's so sad, and it is so preventable. I'm also encouraged by the fact that the folks up here at the table have heart and they have kindness. They have all those things I asked that we bring to the table today, and that is hugely encouraging. But now my question to y'all, a panelist and anybody, I'm getting back to it, is what can we do? It sounds like, from what we've learned today, is that St. Johns County, and I love what Sergeant Talbert said about that, maybe we don't have really high numbers in St. Johns County, but that doesn't really count because we are also impacted by surrounding counties. So one of my questions has been answered today. How are we doing with the opioid epidemic in St. Johns County? We're doing pretty good. But in terms of prevention, what can we do? What can PAC do? What would you like to see the PAC Prevention Coalition do to stay on top of the prevention curve? You're from Care Connect, right? Okay.
I'm listening. This is all really great conversation. I love it. I absolutely 100% agree that we need to continue to focus somewhat on prevention with our youth, but I think the population that we have not spoken about is where are a lot of the youth that are using opioids getting them? So I'm not talking their doctors, I'm talking their grandparents' medicine cabinets, I'm talking their parents' medicine cabinets. So the generation that we're missing the conversation of is people, I'm 47, so it's people that are in that sandwich generation that are raising teenagers or younger people, but also have elderly people that they're taking care of. That population needs to be addressed about harm reduction and reducing the stigma of harm reduction, and I feel like we're missing that portion. So those are like it's people that are our age that are going to the doctors that are getting prescribed opiates for whatever reason that they need them for, and they're in the medicine cabinets, and that's where a lot of our youth are accessing the substances. So I feel like that might potentially be a population to look at, as well as I love the statistics, but are they all really true statistics?
Right.
I mean, there really isn't a true suicide statistic, there isn't a true opioid death statistic because they're skewed with, for whatever reason. I feel like we're missing that population because that's where a lot of our youth are actually accessing the substances from.
I totally hear you on that. I totally. Does anybody else want to add to that or comment on that? Yes.
So I totally 100% agree with you, and one of the things that we've been trying to kind of look at, and I would love to see someone else figure out how to do this, and if they have connections with a school system or something like that, what I would love to see on right before spring break, right before summer, and right before Christmas holidays and all major holidays within the school system, it just so happens that all schools are designed in such a way that all of their drop-off points are roundabouts, and they're very convenient for prescription drug take-back events. So if you were to advertise a couple days in advance, and then you were to basically allow all the parents to know that for a period of days, they could literally drive through, and as they're dropping off their child, they could actually drop off their medication right before they went on to a holiday. They could literally empty out their medicine cabinets right before their house. Their kids are going to be home for the holidays, potentially alone, which would be a great way to reduce harm and kind of get those things out of the house before their children are actually at home alone for a little while. And that's just something that I've been thinking about. It just seems like a really great way to do it just because of the design of the school. There's a lot of schools, they all have kind of the same problems, and we could hit a lot of different places to do it. It's just a matter of coordinating between all of the different people, because you have to have a law enforcement officer present, you have to have the ability to transport those substances off of the school property, and you have to have participation of each of the schools. So there's a lot of coordination that has to go into that. So it's just not something that one person can just kind of turn on and make happen. So it's a big push to make something like that a go. But that was just something that we've been talking about.
Major Dinger, can we talk about that some more later? That just resonates with me, what you're talking about. I'm just curious, just a show of hands in this room, and I know we won't be able to show that, but how many of you guys have currently, like you're talking about, or in the past, or foresee in the future, that you may have children and parents on all kinds of medications in the same environment with children? That is such a good point. How many of y'all are struggling or dealing with that right now? Wow. My Facebook and YouTube buddies can't see that, but in a room of maybe 25 people, 3 people raise their hands. I'd say that's pretty significant. So we do have drug take-back days in St. Johns County. Major Dean, do you want to talk about that just a little bit, what we're already doing? But I think we can definitely build on this.
Obviously, we have the DEA ones, and we have one of our personnel here locally. He actually came up with a really cool concept to go through a retirement community, and he pulled one of our Humvees. He borrowed a Humvee from one of the local units, and he actually drove the Humvee through a retirement community. He wanted everybody in the buildings to basically come down and ask why there was a Humvee in the neighborhood, and then once they came down, he basically said, well, we're here to collect drugs. Why don't you go get your drugs, and you can come back, take a look at the Humvee. And that's essentially what he did, and it was actually pretty successful. But we do those different community events, and typically when we have enough engagement from the community, and it's not a National Guard thing, it has to be one of those community-driven events when you have multiple agencies that are all deploying their Facebook accounts, their social media, saying, hey, we're going to be doing this at this location at this time. We all have these accounts, but how often do we deploy them and synchronize these different messages to make sure that we're actually talking the same message and coordinating those events to make sure that everybody who's looking at all of our different Facebooks actually see what we're doing and get more activity out on the sites to make those events successful. So it's definitely things like that are how we become successful. We just have to unite our forces and just make sure we use all of our capabilities smartly.
So one of our board members, Lieutenant David Tarbert, was looking at some data for me the other day, and one of the things that we identified is that there's kind of 3 groups of ages, and you can see it on the graph that we threw out there, of what's the biggest group in terms of young, middle-aged, elderly group. Who's dying the most from opioid overdoses? And it's the senior citizens. And I had heard that before we came up with the numbers specific for St. Johns County, but what's happening with that? Well, apparently, and this is not scientific, this is just word on the street and speculation, seniors have health issues and they have medications and their bodies are wearing out and they're becoming fragile and they become mentally injured. What was that you said, Major Dinger? Not mental injury, not mental health. I'm gonna start talking that up. That means that's a valuable thing. And so they're mentally injured by the circumstances of their bodies are kind of wearing out, and those are the group of individuals that are dying the most from the opioid overdoses. Something to think about. But on the other hand, we do know, and I believe everyone on this panel would agree, and if you disagree, please speak up, because I don't want to misspeak, but in terms of prevention, the most effective way to get a handle on rates of drug abuse is to reach out to the middle and high school age children before they get addicted. And that's where Art comes in, because he has such a wonderful passion for our young people and strengthening them. So now I'm learning today, and y'all's thoughts and suggestions are invaluable to me, because we want to be real with what St. Johns County needs in terms of prevention. And it's given me a lot of insight today. Does anybody want to add or suggest? Because I'm hearing what you're saying, and I believe that our board is going to have a real serious conversation about the direction that we're going to go in terms of being uniquely geared towards helping St. Johns County.
Chime in on that. One of the things you said is that we're responding in a decent way to the opioid crisis that we have. And I agree. I think our response is good. I think that I want to piggyback what Sergeant Tolbert said. I think that the Sheriff's Office Narcan program has saved countless lives. I think that's fantastic. And we're missing some populations with some of the prevention issues. So I think that's something we can work on. But one of the populations that we really haven't discussed, because it's a little harder for us to touch on, is when we respond to an overdose and we give them Narcan, and then they come around and they don't want to go to the hospital, they don't want anything, we kind of lose that. We lose them to sort of that follow-up. We lose them to sort of the whole system. And it would be nice if we could get a way to come back in and have some outreach to those people later on. We don't have that system in this county. There's some legal and other administrative hurdles to that, in that we can't go to a patient and we're bound by HIPAA, so we can't go to a patient and say, oh, we went to so-and-so as an overdose, and then give that name to somebody else. So there are some ways around that. There are some other places that have looked into programs like that. We've had discussions along those lines, because I think we are missing that very vulnerable population. And like Sergeant Tolbert said, you can't arrest them, can't arrest your way out of that. So I think that we are missing that. In addition to some of the prevention stuff, we're missing a unique group there that I think is highly vulnerable.
So with our Duval pilot, what we are doing is fire and rescue are actually responding to calls, and then if there's an overdose, especially with a pregnant mom, they are leaving the information for Inspire to Rise, and we've actually had some moms, it's only a couple of months old pilot, that have reached out to us, and at least it's something, because like he said, it's illegal for them to call us and say, hi, so-and-so overdose, please reach out. But they joined with us and are helping us do that on scene. And I think if you ask what you all can do as an organization, we have to get to these moms earlier, and we're not getting to them when they're in the hospital giving birth, and they're not going to OBGYNs. We have to go to the places where we don't normally go to. So you have to think of where your pregnant moms are in the county that are not seeking treatment and are using drugs, and go and educate them and try to get them into services as soon as possible, so that by the time they do give birth, hopefully, they've gotten the services they need to titrate down their drug use, or to at least start medication-assisted treatment, and those babies are born less substance exposed. So I just really encourage that. Churches, we've gone to churches, we've gone to food banks, we've gone to homeless shelters. Fire and Rescue is helping us when they go out to the homes to educate moms and leave the information. We've asked the jails. Our sheriff is very supportive of our program, so they're putting the information out in jails, because sometimes these moms get arrested. So just, I would say, reach out to that population as much as possible.
Yes, sir.
Susan, I just kind of wanted to comment on some of the things that were said. So speaking from law enforcement, speaking for myself in a law enforcement capacity, I would love to be able to have someone to direct, a service to direct someone to when we respond to these overdoses. And if nothing else, it would help my personal conscience in putting that person on a path. But hopefully they would listen to that. I can tell you that we do have a tool in law enforcement as far as a Myers Act goes, and we have used that multiple times. About 2 weeks ago, we had a 41-year-old Asian female who overdosed in Jacksonville, was taken to Memorial Hospital in Jacksonville, got out, her sister came and picked her up, brought her to St. Johns County. She overdosed again the next morning. We responded 2 doses of Narcan later. She didn't want to go to the hospital, and basically it was like, well, you're going to go with them or you're going to go with us as a Myers Act. So law enforcement does have a tool to address that. I don't know that every single overdose situation is a Myers Act situation, but there are going to be some times when that is completely a viable tool, and that may just need to be an education thing. And there's a great deal of follow-up resources with that. But in the situations where someone is not taken to a hospital or not taken as a Myers Act, it would be great to put them on a path to services, and I think we're lacking on that right now.
I can speak on that if I may. I'm Anna Hernandez. I'm the community coordinator out of training for SMA, otherwise known as Student Marchman. I have worked with the Synopsis police who have an outreach program where they actually have 2 officers like the downtown Synopsis community with the homeless and whatnot. So I also have worked in one of your victim advocates. I applied for her last name, Stephanie. So I am more than willing to come out to the sheriff's office. I can give you my card, I can give you my brochure, whatever is necessary. And what I'm proud of is that we have a walk-in service. There's obviously referrals to DCF and things of that nature, of course, where I have to report to someone. But we have myself, where a person come in and say, hey, I'm done. I have my mental health symptoms are out of control and or my journeys are out of control, and I can screen them immediately. And I'm not saying go see a doctor that day, please don't take it that way, but I can get them on the schedule to see a provider and or a therapist. As far as they need inpatient services, we do have Sheffield and Daytona, which is our inpatient detox center, and if they are actively detoxing, I can see them, but I would refer them over there so they can get detox, and then they can come back to St. Augustine, and I can get them into services. And unless I enforce it by law, I absolutely don't have to tell that to anybody. They can anonymously come see me.
That's awesome. Thank you for that. We can talk afterwards. I'll get your information and we'll communicate a little bit.
Well, it would be great if we could get like a half sheet of paper that we could leave with them, because obviously they're not going to want to talk to us, but in that moment after we work on and they have a moment to sit and think about it, we left them with something.
Absolutely.
With a phone number where they can be by themselves.
Okay, I can give you cards, I can give you my number, so you guys can call me. I have a work cell, you guys can call me directly.
I'm saying leave it with whoever just overdosed.
Right.
That person that doesn't want it, that they're cognitive enough to say, leave me here, I don't want to go, we can't do anything with them. We can leave them with something so that 30 minutes later, when they're like, I'm in this horrible, horrible place, we've left them with a resource to reach out to.
Yes, sir.
SJSO, SHP, and all of our emergency medical services should have a short referral form from Care Connect to reach out to us as the first point of contact, as we're a hub to be able to refer people to any resources that they are eligible for and that are available in the community. We will get to people within 24 to 48 hours or less. And I also wanted to say about moms, I was at a social determinant of health conference in Nashville, Tennessee. Columbus, Ohio has a very high infant mortality rate. And what they realized is that no one was talking to the moms about the fact that they have a transportation option in their Medicaid. So a lot of moms weren't going to the doctors because they didn't think, well, they couldn't get there, and they didn't know that they were actually covered to get there. I also feel like targeting maternity wards it's too late, obviously, because the babies are already born. And we need to speak to moms earlier on with the OBGYNs and before, like continuing a campaign to address stigma. Because I know myself when I was having my daughter, when I went to tour the hospital and when I was in the maternity ward and everything, I had piles of gifts in the corner of our room that I had not even touched because I was not thinking about any of the literature that was being handed to me. And when we target the lower socioeconomic moms, We're missing the middle-class socioeconomic moms that have the prescriptions that we're discussing right now. So Care Connect Plus is definitely on deck to help however we can as well. And all law enforcement should have that short referral form, and if you don't have it, I will send it out multiple times to everyone.
So we have nearly reached our 5 o'clock magic hour, but I'm just going to throw this out there to the panelists and for y'all too. Years ago, and I don't want to be that old person that says I went to school barefooted in the snow, but there was an experience that turned out to be very effective. And I had another life years ago working for domestic violence prevention, and I had a police department approach me and say, we want you to create a volunteer program that can come alongside us when we are in the moment with a domestic call, and to be that social services, that kind hand that offers support, get them to sign a release, strike while the iron is hot person. So what that looked like is they were on call, and they would ride in the vehicle or they would meet them at the home. We worked out all the logistics, all the legality of that. And what happened is when they were in the moment and the perpetrator was going to go to jail and the victim was freaked out because that's her only income and all this drama, there was this kind voice that was there saying, we can help you with this. There's resources out there, but you have to sign to agree to this. I don't know, would that work in this setting? I'm asking the panelists, some form of that? Would that be something that we could even think about in the future? We may not have a conversation about it today, but send me your thoughts in your emails about that. And y'all too. Y'all, I think everybody has my email address, but something for us to think about, because I'm hearing that we have some situations where people really need help. They've had their Narcan and they're still alive and they need help, but they're not necessarily getting it. And the trauma that you guys face when you're trying to save a life, and you know that if they continue to turn away treatment, that you're going to be back, and it may be too late. And so now you're dealing with mental injuries too. So it affects all of us. Just a thought. I don't want to belabor. I don't want to go over our time. Art, do you want to say anything else before we close? I just want to remind y'all, we have Narcan in the back. We have doTERRA bags. Please take and share. And if you do sign, just check off that you took them, because that's how we track it. There's other resource material back there. Do y'all want to do this again in 6 months? Art says 3. We'll talk. Okay, we'll work on it. And email me things that you would like for us to be able to talk about in this setting, and we'll work on that. Does anybody else want to make any other comments or share anything? I appreciate you all so much. And Alexius, I didn't even mention that we have CHS Communities in Schools here. He's in the schools, and I appreciate you being here, Alexius Ferguson. Pardon? We're trying to figure out if it's okay to pray or not, so maybe we'll pray after. So if nobody has anything else, any more thoughts that they want to share, we're going to close the meeting. And be sure, don't leave until you get some of the stuff out back, because I won't let you out the door. I'm going to go like this and not let you out. So thank you again so much for being here, and we'll see you again in 3 to 6 months. Thank you.